Hi, my name is Brittany Williams, and I'm going to be doing the IV fluid and medication skills video today. So first, I'm just going to start with describing all the supplies that I have. So we have both of our tubing sets. This is the primary tubing. It's at 15 drops, and then we have our secondary set, and this is at 15 drops as well. We have our normal saline, and then we also have amoxicillin that the doctor has ordered. So first off, I will check the doctor's order to make sure everything is good and that it makes sense for the patient. I'm going to verify that the order is correct. So the doctor has ordered 150 milliliters of normal saline over an hour, and then also 250 milligrams that comes in 100 milliliters of amoxicillin. So the conversions for that, the fluid is 150 milliliters over 60 minutes. That'll be times 15 drops over ml, and that comes to 37.5. You're going to round that to 38 drops per minute. And then for the medication, we have 15 drops over ml times 100 milliliters over 15 minutes, and that comes to 100 drops per minute. I don't know if you can see it. All right, so next I'm going to describe the tubing that we have here. So this one will be, the primary will be used for the fluid. So it's a little tangled. Okay, so this is the spike, and you want to keep this cap on at all times because you want to keep it sterile, because this is what's going into the bag. So you keep the cap on until you're ready to take it off and apply it in the bag. Then we have the drip chamber. This is this part. This helps with regulating the air, and it also gives us a visual of our flow rate. This is our roller clamp. This helps us to control the flow rate. When it's in the down position, it is closed. When you roll it up, it is open. Here is the Y site. This is where the medication will be inserted into. And then we also have the adapter in, and this is where it goes into the patient's peripheral IV site. So the second one has the same things. We have the spike, the drip chamber, the roller clamp, and this one does not have a Y site. It just has the adapter in. All right, so now that I have verified the orders, I'm also going to check the 6 rights of medication, which is the right patient, right medication, right dose, right route, right time, and right documentation. So that's when I'll gather all of my supplies and I'll knock on the patient's door, close it for privacy. I'll introduce myself. I will also ask the patient their name and date of birth to get the verification, and I'll check their wristband to get that second step of verification. I will then explain what I'm going to be doing today, which is administering fluids and medication through their IV peripheral site. I will then ask, do they have any allergies? And then I will also check the charts and ensure they don't have any allergies to any medication. I ask the patient if they have any questions. Before I proceed, they don't have questions, so I will perform hand hygiene. Forgot to mention that I have an alcohol prep pad. Apply my gloves. All right, so you're going to start with the fluid first, and this bag is going to go under the medication, and you also want to ensure that your bags are at least 30 inches above the IV site. Okay, so you will flip the bag this way, you will take your primary tubing. You will remove this top. Remove this top. You're gonna stick this in here. You're gonna turn it over, and you're just gonna get a little bit of fluid in here, about halfway, so you can get the air bubbles out. And then you will hang this on the lower end. Okay, and then you will slowly open your roller clamp so the fluid can go through the tubing, and this will ensure that there's no air bubbles. Okay, now once you have done that, you're going to lock it back. All right, so typically the adapter end will go into the patient's peripheral IV site, and before doing this, you're going to check the site, the patient's site, for any redness, swelling, irritation, or pain. But because we don't have a patient, we're just going to act like this is in the patient. I'm just going to set this down here. And for the, sorry, just removing this trash. For the fluid, you want to ensure that you're at 38 drops per minute. So you're going to slowly release your clamp up and count for 1 full minute, 38 drops. So that bag is set. Next, you're going to grab the medication bag, which has the amoxicillin. You're going to verify again that you have the correct medication. I will perform the 6 rites of medication again, just to be sure, as well as checking for allergies again, because this is amoxicillin. And then it's already labeled. So you're going to hang this bag above your fluid, and again, both bags need to be at least 30 inches above your patient's peripheral site. So you're going to do the same thing. You're going to prime your bag, your medication, remove the top, remove the top to the spike. Place that in there. Again, fill your chamber enough to get the air bubbles out, about halfway through. My clamp is locked. We're going to hang this bag above our fluids. And we're going to slowly release to get out the air bubbles. Alright, so you're just going to make sure that there's no air bubbles in this tubing. And we're going to clamp this back. Then you're going to connect this to your Y site, but first you're going to want to clean this with the alcohol prep pad. Real good. And you're going to wait about 15 seconds to ensure that it's dry. Okay, then you're going to connect your Y site to your adapter in. You want to make sure it's on there nice and snug. So for the medication, you want to do 100 drops per minute. So again, we're going to slowly release. All right, so now that all is all done, you're gonna go back and recheck the patient's site, make sure it's not irritated, they're not in pain, any redness or swelling again. You're gonna make sure your patient is comfortable. You're gonna give them a call light, see if they have any questions. You're gonna wait around for a little just to make sure that there's no sensitivity or reactions to the amoxicillin. Once you verify that your patient is good and comfortable, I'm going to dispose of all of my trash. Remove my gloves. Perform hand hygiene, and I will document.